This is the continuation of the peritoneal dialysis series video, part 2. In this, we will see regarding what are the types of peritoneal dialysis, what are all the terminologies which is being used commonly, where the students usually get confused. So let us understand it from the basics. So in the first part, we have seen in the renal replacement therapy, PD, peritoneal dialysis, is one of the modality. It's trying to replace the excretory and the homeostasis functions of the kidney. So to know the types of PD, first we will see how we are going to divide it into the types using what criteria we are going to see. First is the duration. Why we need the peritoneal dialysis, whether we need it for a long period of time as occurs in a chronic kidney failure, or we need the kidney function to be replaced in the short period of time. So based on the duration of the requirement, we can classify peritoneal dialysis. Second one is the based on the modality that we are using. What kind of methods we are using, we can classify the peritoneal dialysis. Third is the method. How we are going to use the fluid or how much duration we are going to keep. Based on that, you can divide the peritoneal dialysis. If we even take a text with regarding to peritoneal dialysis, few students get confused with respect to the classification. So this is the base how the classification of peritoneal dialysis can be done. We'll see one by one. First, with respect to the duration. As I told, the kidney can go for a dysfunction in acute state or in the chronic state. So it is the acute kidney injury where patient need dialysis for a short period of time and the kidney functions will recover. This usually happens in ICU. So if the kidney goes for dysfunction for a short period of time, during that time, if you are using peritoneal dialysis, that is called as acute PD, acute peritoneal dialysis. Suppose if we are using it for a CKD patient, that is called as chronic PD. So this is the classification based on the duration. Either chronic kidney disease, we are using the peritoneal dialysis as a RRT modality. We will call it as chronic PD. In short duration, if we require, it is called as acute PD. This usually is required in the ICU setup. This in the OPD setup. Probably a patient who doesn't want to go for hemodialysis, we will select this one. Is the other difference with respect to this acute PD and the chronic PD? The catheter type. Previously, there was separate temporary catheters are available. Nowadays, the recommendation shares only to use the cuffed catheter, that is the catheter which can stay in the abdomen for a long period of time for chronic PD. Since the topic of discussion today is types, I'm not going into the discussion of the difference between these two. So, with respect to the first criteria, duration, we can label it as acute PD or chronic PD. That is the nomenclature being used. Next, we will go to the next method. What is the next method? How we are going to use the modality. Here is the a bit confusing part. Even the nephro first years and the medicine residents sometimes have doubt why the nomenclature is so. First, we will let us understand it in a simple terminology. Whether I am going to do it using the help of a machine, whether I am going to put the fluid with the help of the machine into the abdomen and take it out with the help of the machine. That is called automated peritoneal dialysis. If I do it manually, if the patient is doing it manually, that is called as manual PD. Manual PD or automated PD. This is being abbreviated as APD, automated peritoneal dialysis. Here there is a catch in the nomenclature. Here we won't use MPD. There is some other terminology which comes. What terminology? I will let you know after explaining what is manual, what is automated. Automated means this is an automated peritoneal dialysis machine. This is a machine to keep the peritoneal fluid back here. The wires are connected. This machine itself will push the fluid into the patient abdomen, and after a set duration, it will take it out. The drainage and the input, the machine is managing. For example, this is the patient where this machine is there. There is nothing to do manually. You just keep it, the machine will push it in the abdomen and take it out. So this we call it as automated PD or APD, automated PD. The second one is manual. In this, there is no machine. Only the bag is there. You can see the bag, and the fluid goes into the patient abdomen with the help of the gravity. And after 3 hours, 4 hours, whatever the time period we are setting, the patient have to drain it out. It will be in the abdomen. He will detach that bag. After 3 hours, he have to drain it out. This is called manual PD. Till here, I hope you are clear. And what is the catch in the nomenclature is automated PD, easily understandable. Instead of the term manual PD, they use the another terminology since the patient's using it by gravity and it is being used in the chronic patient. The patients are ambulatory. Ambulatory peritoneal dialysis. Since it has to be given continuously, the fluid will be put inside the abdomen. It have to be taken continuously. So it is called as continuous ambulatory peritoneal dialysis. Here is the catch. This continuous ambulatory peritoneal dialysis. The patients are mobile. They are doing it continuously. Peritoneal dialysis. Continuous ambulatory peritoneal dialysis being done manually. Here it is done automatically. That is APD. That is CAPD. This is where most students, many a times as a beginner in the NEPHRO journey, they will get confused. What is this CAPD? What is APD? See, this is annual PD. Since the patients are mobile and ambulatory, is added. It is being done continuously, continuous ambulatory peritoneal dialysis. Okay, then another question obviously comes: is it not continuous? Yes, it is also continuous. So that is why I told just understand it in the simple terms that we are using manually and the terminology CAPD. If we use the machine, then we call it as automated peritoneal dialysis. This is based on the uh, modality. Again, the type is we have seen. And coming to the first what we have seen, based on the duration, I can classify it as acute PD or chronic PD. Based on the method, I can say it as manual or CAPD or automated peritoneal dialysis if the machine uses it. Then coming to the modality, what is this? This classification is somewhat in detail. Here depends on the amount of the fluid, depends on the uh, time of the day, whether it is in the daytime or in the night time, how much volume being used. There are various other parameters where you can put in new terminology comes in. For example, if you are doing in the night, we can call it as nocturnal. Since we are not doing in the day, it is not a continuous one. Nocturnal intermittent peritoneal dialysis. So I will remove this initial 2 and 3. So if I classify only the automated peritoneal dialysis can be done in the night because manually it is very difficult. So that's why this kind of terminology being applied to automated peritoneal dialysis. So in the night, if I am doing, if the patient is doing or I'm advising for the dialysis, that it is called as nocturnal intermittent peritoneal dialysis. Based on the volume, I can say high volume or low volume peritoneal dialysis, continuous or intermittent, I can label it. So the APD can be further divided into multiple types. Sorry, the APD, if I'm advising it in the night, it is called as nocturnal peritoneal dialysis. If the APD is done in the day also continuously, then it is called cyclical continuous peritoneal dialysis. And there are further classification like tidal PD, hybrid systems are there, and further classification of automated intermittent PD. Many types under the APD are there. This we will see in the next video regarding subtypes of APD. So, please, for today's topic, we have completed the PD types. We can say as acute PD or chronic PD, annual or automated, manual being called as CFPD. The third one is the based on the modality, APD is being classified to multiple types that we are going to see in the next video. This is all regarding types of PD, peritoneal dialysis.